There's really a very, very huge difference, especially when it comes to cost. Um, I would say the cost being educated internationally is very cheap.
Mm-hmm.
Everything of the nursing education in the Philippines, especially during my time, I can remember the whole semester I was only paying 700 pesos.
Mm.
Compared to here in America, oh my God, if I am not mistaken, just for one quarter, so that means to say that's only 3 months of the year, students are paying 8,000 to $9,000.
Oh,
If you're going to convert 8,000 to 9,000, that's, I would say, like, I would just take the 50 pesos. That's like almost a half million.
yeah,
That's only one quarter.
yeah,
And you are not even like sure whether you're going to really graduate with your four
yeah.
years in
That's right.
the BSN or whatever.
Mm-hmm.
And then I guess another difference that I would say is that the number of years. Um, I would just say during my time, because I'm old. During my time, nursing was 5 years. So
Mm.
5 years of for you to become a BSN. And here in the United States, if you're locally educated, it's very expensive. But the only thing is they have so many um, pathways or paths of nursing. They have the accelerated program wherein the BSN would only I would say you would finish your BSN for only 3 years.
Mm.
And then they also have the path for ADN, which we don't have in the Philippines.
Mm-hmm.
Mm-hmm.
That's the Associate Diploma in Nursing. But to tell you honestly, whether you're going to graduate BSN or ADN, you're going to work the same in the hospital. You can still like work or you can have the same scope of nursing as the BSN. Um, I guess the only difference is that if you are going to graduate with an ADN course only here in the US, if you want to go into teaching, you cannot because they will only the lowest, I would say the lowest kind of program that you can teach in the College of Nursing is the BSN. And you cannot even do classroom instruction if you're a BSN. You can only do clinical
Mm-hmm.
instructions.
So you
We
have to.
call it here the clinical teaching assistants.
Mm-hmm.
You can only teach the classroom. You can only, and you cannot be in the classroom in the Philippines. You are immediately called as instructor or professor or associate professor. But here, no. Um, you will start as a teaching assistant if you're BSN, but if you have your MSN, then that's the time you can be a rather in the professorial chair. Um,
Mm-hmm.
and then I guess aside from the pathways, like different pathways, BSN, ADN, LVN, uh, the only thing with LVN is that their scope is different from both the BSN and the, how do you call this one, the ADNs. Um, I guess that's the main thing really that I can say when it comes to the difference.
Mm-hmm.
It's the cost. The cost really is the major factor.
It's very expensive, right? I mean, you can probably send a doctor with that 20,000
Oh my
back
I
home.
God.
know. In the
Half
Correct.
Philippines, yeah.
million. One
Yes.
quarter only.
Yes.
Okay. I'm Chana Pasaron. I have been nursing for almost 39 years. This year, especially on March 26, it will be my 40th year. I graduated my BSN, University of San Carlos in Cebu, and my master's in UP Diliman, Manila.
Mm-hmm.
Um, I first started as a teaching apprentice in San Carlos. It was because I graduated at the age of 19. I
Mm.
became a registered nurse at the age of 19. But unfortunately, the PRC or the Philippine Board of Nursing will only release my license if I am 21 years old. So the school where I graduated created a position for me, and that is that being a teaching apprentice. And then after that, when I had my license, I worked in Southern Islands Hospital. And I also continued working as a clinical instructor in San Carlos. And then when I was a little bit older, I would not say the years, but I started working in Saudi and in Dubai as a
Mm.
chief nurse.
Wow.
And after Dubai, I was being hired directly by Cleveland Clinic. There were actually 300 nurses from Cebu at the time that they hired. So I was one of them. And from Cleveland Clinic, uh, I transferred to Texas, and now totally I am in the teaching or in the academy,
Mm-hmm.
um, not anymore in the bedside nursing.
Mm-hmm. Yeah.
So I guess that's it, Mike.
Yeah. Thank you. Katambay, Jonah.
That's her expertise on the education part. I don't know the education part here in the United States. It's different.
How about the
But I
skills?
did that's what the skills I can tell you about the skills because in the Philippines, the educational system in the Philippines, because in our second year, in second term, we're already exposed in the hospital setting.
Mm.
We already started everything. We already started IV. We already taught how to insert a catheter and everything. But
Mm.
in here, because we have this conversation with my coworkers, how what's the difference, and here I noticed that they don't have the hands-on yet.
Correct.
They only practice with the mannequins,
Mm.
and that's why most of the RNs here in the United States, when they graduate and they pass their boards, when they landed at the hospital, they have to go under training, and most of them are still not comfortable on taking care of the patient one on one because
Mhm.
the only thing they practice is the mannequin. It was easier for most of us nurses from the Philippines coming here in the U.S. is we already have the confidence. The only difference is the equipments that we have, especially that I work in Southern Islands Hospital,
Mhm.
which is in Cebu, which is a
Yeah.
government hospital,
Yeah.
that we have to make shift some of it. So it was I get intimidated with the machines and the equipments that they have.
Mhm.
So it was easier for me too because most of us we can really with them with new equipments that they have, as long as we've been trained, we be
Yeah,
able to adopt right away.
that's
That's the
true.
only difference. And because I do also precepting new nurses in unit, and that's what I've noticed, that they are very scared. I would say like not get intimidated and really not comfortable starting an IV. And
Mm-hmm.
in the
That's
Philippines,
true.
this is already a basic thing when we're in a second or
Mhm.
third year because we're already exposed.
Mhm.
Even our when we graduate in the Philippines, before our one of the requirements before we even graduate, we have to have a charge nurse experience. So we are
Mm-hmm.
shadowing
That's
charge
true.
nurses on the other hospitals, and we were exposed because my clinical what is this internship is in Chongwa Hospital, because the UC and Chongwa Hospital are there are the same. I wonder if there's the
I
same
guess it's the same owner.
owner.
Yeah,
So we were exposed in the Chongwa Hospital. I don't know if it's still Chongwa Hospital nowadays.
I guess so.
So,
They still do with Chongwa.
yeah. So it is different. I mean, I would always say, that's why I always say my friends or relatives, families that are nurses, and it's like, don't be scared coming in here. Because I felt like the skill wise, we are more skilled than the nurses that graduated here. And I would always say, there's a friend of ours that their kids that wanted to be a nurse, they send them to the Philippines. I have two friends that they send
Mhm.
them to the Philippines for schooling because it's expensive here.
Yeah,
And there's more experience over there because we also exposed in the community setting, that we were like go to the community do the what is this, immunizations, and we were still student then. I think there was like third year exposure or second year exposure.
Yeah, I guess it's second year, the
Second
community
year,
health nursing.
second semester, we already start expose. We were already exposed in a hospital setting, community setting. We even give educations, um, and immunizations, and so it was really, for me, it was easier transition for me, except for the culture that we have when we came in here. I think all of us do when we arrived here from the Philippines to here.
Yeah.
It's a culture shock. I mean, it's different culture,
Yeah.
and sometimes we get intimidated because of the language as well too. I mean, our second language is in English, but still, we don't, the terms and the pronunciation of some other stuff, because there are some words in the Philippines that we have to pronounce it by syllables. And it was so funny. I have this experience when I was in New Jersey, and then I was just like, there's a patient that was coughing, and I said, "You have cough medication," and he says, "Oh, really?" And it's like, "Yeah, you doctor ordered for a cough medication for you." And then I say Robitussin, which is in the Philippines we call it Robitussin. And I was just newly landed from the Philippines to New
Yeah.
Jersey. And then he says, "What is that?" And I said, "It's for cough." And he was just like, and I showed him and I spelled it to him and I said, "Oh,
Robitussin.
Robitussin." It's like, okay, now I learn a word now, Robitussin. So there's some, it's more the accent and everything, and sometimes it's, and you don't need, I would just gonna, because this is kind of more educational, I'm gonna tell this to the nurses in the Philippines that are desired to come in the US. Don't be scared. I mean, I felt like the Filipinos are more judgmental than the Americans.
That's true.
And as long as they understood you, I mean, they will not judge you on how you speak and how you tell them, and you just explain it how you. Sometimes I was just like, okay, I'm gonna explain it for me in my mind or in my thought as in Bisaya, and then I will speak it in English, and that's how I talk to them. And even though we have the same different ways of communication, they can still able to comprehend what you're trying to say. So which is, it was that's why I was always telling the nurses from the Philippines, because most of them is like, is it scary? And so at first it is, because you get intimidated with the culture over here, but as long as you just be yourself
Yeah.
and apply your what is this, your skills, you'll be fine. That's why most of the Americans, and even just not than Americans, even in Europe, they love Filipinos how they love, because we work like heartedly. I mean, we are very compassionate.
Passionate, yeah.
That is our culture already,
Yeah.
and then it was not hard for us to do it here, because it's our culture. It's us.
Yeah.
That's us. And my name is Genevieve Angeles, and I've been a nurse. I will be 33 years this April this year. Most of my RN years are been in med surg areas, and so it's pretty much my passion to be at the bedside. I would rather have been a bedside rather than an office setting. From the Philippines, I most my experience was as a company nurse, and I started with the like Metro Gaisano as a company nurse for years. I think that was 5 or 6 years. I can't remember now. And then I went to Pacific Online as a company nurse, which is a gaming company. And then after that, when I passed the CGFNS, and I was like, you know what, this nursing career of mine, it's a calling for me to work abroad. So I went to have my experience in a clinical setting, which would be the staff nurse, and also charging on the unit of Southern Islands Hospital, which is a nonprofit hospital or semi-government, I would
Government,
say.
yeah, it's government, yeah.
After that, I went to New Jersey for about 3 years, which is my contract with the agency. And after my contract ended, since my husband is an IT profession, so I told him like, you know what, nursing is everywhere anyway. Whichever you can find a job that's in your line, and then
That's
I will
correct.
follow. So he got the job from Austin in his line as an IT, and that's why we're here in Austin. So we've been in Austin for more than 20 years, and raising the 4 kids is kind of tough because we don't have any relatives here and working as nurse as well. So I started here in South Austin Hospital as a medical surgical nursing night shift. And I've been working night shift until I went to now presently I'm with Seton Hospital, which now I'm working with the surgical services as a charge nurse in one of the pre-op and endoscopy unit. So I've been here and I love it. I love working as a nurse as a profession and in a bedside, and that's pretty much I felt like it's more a calling than a profession for me, because I'm working as for more than 30 years or 32, 33 years to be exact. It's rewarding.
In the Philippines or internationally, the international uh, educated nurses, for classroom, I can still remember when I used to teach in that school. I carry 35 to 40 students in one classroom. But here in the United States, it's a no-no. You
Mm-hmm.
all are only allowed to have 15 students in a classroom. If you're going to have more than 15 uh, in that class or in that course, then there should be two clinical instructors or there should be two theory or lab instructors. But in the Philippines, oh my God, one teacher
Some
versus 35 to 40 students. And there was even a time when nursing was booming in the 80s that I was able to have a class of 50 students in one
Wow.
classroom. And then we were using the amphitheater at the time
Mm-hmm.
because
Oh yeah,
we don't
I
have
remember that.
the normal classrooms anymore. So we were using the amphitheaters of the school just to cater to those 50 students.
Mm-hmm.
I
Yeah.
mean, I guess that's one of the difference. And then in the clinicals, I just would like to expound as what Genevieve was saying. There is really, I mean, Philippines really. If I remember it right, my director in Cleveland Clinic was really asking me secretly. She told me, her name was Julie. She told me, Chona, can you tell me why I really don't have problem with Filipino nurses? And then why is it that all of you come here so good? I mean, you are so good in IVs. Like only one time we're in compared to my other nurses, we're in. They're going to shoot the IVs after three times, four times. And then I told Julie, it has something to do also with our health system. Because in the Philippines, everything is being paid, self pay. The patients are self
Yeah.
pay. So you have to make sure that your IV is only like one shoot. Because imagine you're going to charge and charge and charge the
Yeah,
patient for a kit of
a kid.
IV. That's very, very expensive. Here in the States, as if like
Yeah.
you would just get in the Pixis or Omnicell or how you call it, the supply room, and then to tell you honestly, I find them so wasteful
Yeah, it is. Yeah.
because they are just like, oh, I did not do it, so they throw the rest of the equipment. But in the Philippines, like we always save
Yeah, we always save.
what needs to be saved and what we can save for the equipment. And I can remember, I'm so sorry to say this, but when gloves was I mean was when gloves was not in yet,
Mm-hmm.
we have to wash.
Yeah.
This is
Oh, I remember that.
we have to wash
Yeah.
gloves
No.
and then repowder them.
Yeah.
Yeah.
Like
Mine, my the
Those are the
syringes.
years, right?
Because here they have the disposable syringe.
At ours, we have to
Ours, we have to
autoclave.
autoclave in the Philippines. I don't know if they have disposable nowadays in the Philippines, but we have, especially in the hospital that I work
Public
because
s-
it's a
It's a
public
Public school,
public.
yeah.
public hospital. So we have to reuse them.
Yeah.
And I used to work in the what is that ward that they have like, I don't know, I feel like
90
50
patients.
and
Because I
only
know.
and only one or two nurses.
Yes, with
And
an
especially
aide.
night shift.
Uh-huh.
And no one believes me that when I share this to my coworkers over here, it's like that's crazy, Genevieve. It's like I know,
And we
but
don't complain.
we don't complain. We don't even have a pumps.
Yeah,
We
that's
do it
true.
manually.
Yeah,
Manually.
And then the other thing too is the family. We have to require family at bedside
Yes.
because we can't do everything. The care, the bedside care is done by the family, not us.
Because the family members are actually like the PCT here.
Yeah.
Yeah, I know. They do everything. And it's even the arm board, like those what's the arm board that to keep that arm straight when you have the IV because it's on the
Yeah.
AC, it gets on bending, especially with the kids.
Newspaper.
We we
Improvised.
improvised. So that's why I was even telling this story to my kids, and my kids were just like, "Mom, if there's a World War III, God forbid, you." They will call you
Yeah.
to help out because you know what to do. And said, I do really, because even the ambubag and everything, we improvise. And I cannot believe that over here, and you're right, you felt like they just like open and waste it.
Yeah.
And then there's the expiry date. And I was just
Yes.
looking at it, it's like, can I send this to the Philippines? It's still not. As soon as it expired, they will
Yeah,
just
because
throw
you
it
will
away.
be you will be in trouble also with JACO and whoever
That's
is
right.
like
That's right.
whoever is like going to inspect the
and
hospital.
and I think that's the other reason too. Now you're talking about law. The law is different over here, and they're very
Yeah, I know.
strict. And I think it's sue here and sue there. They don't want to be sued and everything. And I think that's the reason. I felt like that's the reason why that those nurses, when they're still student, they can do they cannot do hands on.
Yeah, because I can remember I also told one of my students or my group of students, like, you know what, in the Philippines, we don't have this kind of mannequins that you have. Our mannequins in the clinical setting, I mean in the school, imagine just one mannequin would cost $200,000. So how can a Philippine school afford just for a mannequin? So what we are doing in the Philippines is that we are partnering each other to do the injections and partnered. So that is why we have a ruling there. Uh, how do you call this one? What you see, leave it here. Because if I remember, I don't know, Genevieve, during your time, if you still do enema partner by partner.
Yeah, we do.
So I can see the butt of my classmates. So that is why what you see, leave it here.
Yeah.
Because like it's really like different. And then Genevieve is right. They're very particular with lawsuits. So that is why they cannot do partner by partner, because if something will happen to Genevieve's arm because of my doing, then I can be sued because there's no waiver for that one.
Yeah.
That is why they have to use mannequins.
And I just felt I felt sometimes I felt bad with those students because we do have students that goes to our unit
Yeah,
and
that's
just
true.
to just to watch the nurses, and pretty much they just there to watch and said,
It's
why
purely
you guys
observation.
why you guys cannot do IVs? And there's, oh, we need an instructor at our site, and we only have one instructor. And said, because before in our time when we go to the hospital, the charge nurse on that unit is the one who's following us.
Yeah.
So it's kind of hard. I mean, it's very painful for me to see because I really love to teach nurses, especially those new ones. I love to teach them because I love this profession. As I said, this is not just a profession, it's a calling. And if you have that passion, and I can always tell those students that they have this passion with this profession, it's painful to see that they're only standing there and watch us do what we're doing. For what? For how many hours? 8 hours. And it's just like they were just standing there and like, okay. And then how we chart, and sometimes I gave them instructions that we gave to the patients, like about the procedure, except since I'm in the surgical services and we are in pre-op. So we have this instructions that we give to our patients. I handed it to them so
For
they
them
will
to.
know to understand what's going on and the discharge instruction too. So what do is I'm not just letting them to go to pre-op. Sometimes I let them follow with that patient from pre-op going to the procedure room. Some other school doesn't want them to go to the procedure room. If they are allowed, then procedure room to recover until they get discharged. So they will know the flow from the patient going into the pre-op, going to a procedure, going to recovery until they get discharged. And it really, I think that's the only thing that I can probably help them out is to understand the flow. But it's just painful to see that they cannot do hands-on.
Yeah, that's really true because they have so many restrictions. I mean, especially with lawsuits, and then there's so many restrictions from the Board of Nursing here. Because imagine a nursing student in the Philippines can give narcotics, but here they don't.
No.
They cannot even like give Lovenox or any blood thinners. But in the Philippines, like, oh, for as long as it's injection, subcutaneous, whatever, we
We do
give all.
everything. Yeah. Yeah.
Yeah. So my next question, being internationally educated nurses, what is the biggest adjustment when working here in the U.S.? You probably in Dubai and here.
Me, to tell you honestly, Genevieve already mentioned about this one. It's the culture, and especially also the communication. Communication was really the barrier. I mean, I would say, I'm so sorry. I'm not being discriminatory or whatever, but it helps being a Cebuano because Cebu's second language really is English. So I guess I would say, I'm not like, not, I'm so sorry, whoever is the audience, whoever's going to watch this, no bashing. But Cebuanos speak better English compared to the other regions in the Philippines. Because I can remember I have a colleague wherein my director was calling me. She told me, she asked me like, "Hey, Chona, you and blah 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 came all the way from the Philippines, but how come you speak better English with a better accent?" Because I still have my Filipino accent than her. And then I told our director, like, it has something to do with your native tongue. Because especially there's a region in the Philippines where in the native tongue really is. So I would say like they're going to say the words so hard. I mean, especially the accent, the intonation, the enunciations, and everything compared to Cebuanos. So that is why communication for me at that time, even though I know I have the accent, but I didn't care because anyways, in the US, also white people, they also have their accent. Let's say for example, if this white person comes from Tennessee,
They have.
she has also
Yeah.
her own accent. And then is this person comes, white person comes from Texas or Arizona, they also have their accent. For as long as I can speak good English and I can explain to my patient, then I'm good. But I guess it's more of the communication
Communications. Yeah.
because not all schools in the Philippines is using English as the main medium of
Instruction.
instructions. Yeah. So I guess it's the communication
Yeah.
barrier
Yeah. Yeah.
and
Yeah.
culture.
And culture. Yeah, number one is culture.
Culture.
Yeah.
And it's as I said, it's intimidating for us coming in here, and we felt like we're outsiders. We already have the like, oh, I'm not from here. They might gonna treat me differently. So that's the other barrier too, which is now that we've been here for more than
Yeah.
two decades.
We can say everything.
So I can always say like, you know what? Just come and be yourself. Bring that good vibes. You can say you have the good vibes. Good vibes as a Filipino, because Filipino is very everywhere. You can always hear, just not just here in the United States, even in Europe, they always have praises with the Filipinos because we already equipped with compassion. We
Yeah.
already in always in service to each other.
Especially during COVID.
Yeah.
I mean, probably I guess you have seen also TikToks or whatever were in Filipino nurses are being praised
Mm-hmm.
by foreign nationals, taking care with compassion despite of the COVID, trying to not display their fears of dying. Like, I
Hmm.
mean, everybody was afraid to die during COVID.
And
Yeah.
I think the other one too is respect.
Mm-hmm.
We are very respectful with our elders.
Yeah,
Yeah.
that's true.
So even like someone is talking, even our doctors, I still call them sir or doc.
Yeah,
And compared to others, like sometimes I call them their
first
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 names.
name.
name.
Yeah.
So I call them
Yeah.
sir, and if they're talking in between me, I still have excuse me. And here you just like pass by and they will look at me, or what are you doing? Because I was have to like go lower to them so that they can talk. It's more on respect, especially with elders. Especially we have um, patients that are elderly patients. They always appreciate Filipino nurses because we're
Right.
very
Yeah.
respectful.
Yeah.
And even if we get yelled at,
I know.
we're,
We don't
we're
care.
we don't. Yeah, that's the other thing too. We don't take it personally.
Yeah.
Yeah.
Because it's part of our job.
It is.
And we don't think about, okay, this is a mean patient. And I think that's why one of my clinical assistant or the CA, she always tell me, she said, Genevieve, I was working still in the med surg unit. It is a very, very tough unit, and I was working night shift. And then she says, I love you as a nurse. You've always been very helpful. But at the same time, I hate following you. And it's like, what are you talking about? Said they always give you the heaviest patient.
Yeah.
You never complain. And I said, I only complain if I cannot do it. I mean, if I'm already like drowning, it's like, okay,
Yeah.
I need some help. But if I can still manage, then I will keep on going. And that's why she's like, that's the thing. They always give you the heaviest patient.
Yeah.
And like, if I can do it, I'm gonna keep on going. And if I cannot do it, if I felt like I'm drowning, then I will say something.
Hmm.
Yeah. Based on, I mean, if I'm going to make a follow up on that, Genevieve, I've experienced that one too. Wherein, I mean, I'm so sorry. Again, no bashing, but for the white nurses, really, sometimes they was like, "Oh, do you need help?" And then they're asking for if you need help, it's just like sort of like a courtesy, because once you're going to think, oh yeah, I'm really caught up, can you do the vitals of this patient and blah blah blah, and then they will answer you back, Jonah, like, so what do you mean you don't want to help me? But you were already asking if I
Offering.
need help.
Yeah. So you mentioned about communication a while ago. So how important are communication skills, documentations, and workplace culture here in the U.S. in nursing practice?
Oh my God, communication really is very important. And
Hmm.
then I guess, for the internationally educated nurses, we the Filipinos, I guess we pass to the standards, I would
Hmm.
say, because before we can come here and work, we have to pass the TOEFL. We have to pass the TSE. I don't know. Probably during your time, it was already the
I
IELTS.
still have no. I
Oh,
still have
okay,
to take
still
the
the
TSC
I,
and the.
because I know they fuse it now.
Yeah.
It's already IELTS. I don't know what's the meaning of that IELTS, but I know during my time it was TOEFL, which was the written English,
Written English,
and
and
then the
then
TSE, the spoken English. So, communication really is very important. And then I would say that every schools, especially the colleges in the Philippines, should be using using English as the medium of instructions. Because I graduated with my masters in UP. Oh my God, I'm so sorry, UP people, but they call themselves purista. Purista meaning to say, as much as possible, if you can speak everything in Tagalog. Like, I cannot, because like, uh probably I can understand some or
Mhm.
most, but if I'm going to speak Tagalog, I don't want them to laugh at me because it
Mm-hmm.
might be very, very strong,
I
my
think
accent.
most Cebuanos are. When we are more fluent in English rather
English.
than speaking in
Yeah,
Tagalog.
because that's our
I
second
felt like I
language.
felt like my tongue get twisted when I speak Tagalog. It happens to us in a unit that we have three Filipinos that speak Tagalog and then three of us speak Bisaya. And then they get confused because they knew that we are all
From the Philippines.
Filipinos. And then they will say, Genevieve, you speak to this person in your in different language, which is the Visaya, but why are you speaking English in the other group and you're both Filipinos? Like, you don't know that because we have different
Yeah.
languages. And it's like, really? And it's like, I cannot speak. I mean, I can understand Tagalog. I sometimes I can speak in Tagalog, but not as fluent as those
Correct.
people in Tagalog. I rather speak it in English rather than speak in Tagalog. It's like
Yeah.
I'm just not comfortable speaking in Tagalog.
Yeah,
So
me too.
about the communication, about your question, it's very important for the nurses. We are considered as an advocate with our
Correct.
patients, and the communication is very vital. So anything, most of the patients over here, or even around the world, that's not in the medical profession, they don't know what to ask. They don't know what to expect. So if they have some if you see or if during your assessment there's something going on and you need to call the doctor, most of the nurses like so hesitant, especially if they have a mean doctor to call at the middle of the night.
Oh, yeah.
So as I said, put yourself, always think as a nurse that you are an advocate for this patient. You have to communicate this to whoever the doctor is for this patient, or to
Correct.
communicate for patient safety, of course. So we always bold and we always like, especially if you knew that there's something going on and something wrong, you have to voice this out. The charting part is very
There's
important as well.
documentation
The
there.
Yes,
Yeah.
documentation,
documentation.
especially as we mentioned earlier, the suing is very rampant over here. And since, aside from being an advocate, you make sure that the patient is safe and everything is documented, every detail, every minute things. You cannot just say, oh, patient is not in distress, alert oriented, sleeping, will monitor. You cannot say that. You have to make sure that everything in details is documented. You have to make sure that the patient vital signs are stable. And I even put like all the vital signs there, even if it's stable. I just want to make
Yes.
sure. As I said, we've been trying to protect our license at the same time, aside
Correct.
from protecting the patient. So documentation is very vital. Every minute things, and I think that's the other thing too with the nurses that have the schooling in the Philippines, because we have this written
Yeah.
charting that we learn, and I still use them. And even if with the computer, with the computer stuff, the 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 nurses nowadays, I think because of the computer charting, the critical thinking was taken away from them because it's already set up on this computer. You're just gonna click, 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 and you don't have
Yeah.
those critical thinking
Yeah,
anymore.
that's true.
There's like a protocol for this and that. You give this medication if this and that, 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 which is sometimes I get frustrated, especially if I get report. Sometimes I hope they're not mark me as the mean nurse or the bully nurse, because it's so frustrating. As sometimes I will tell them, okay, you know that this patient's H&H is dropping, that the blood levels, and this patient is going for surgery.
Yeah.
Did we ask? Did we even try to ask for an order for type and screen?
Correct.
Since you already know the trends that this H&A, they don't care about that because it's not on the computer, it's not in protocol. And it's just so painful to see that those nurses, I mean, I felt like it's not their fault actually, because of this computers that's going on right now, that they don't have time. The bedside care, it's already taking away from the nurses, because they have to chart everything before the shift ends. Sometimes they can't even live after the shift. They're still charting
Jordan, yeah.
until 8, and they're supposed their shift's supposed to end at 7, and they're still charting at 8. And that's the other thing. I think one of the reason I went to pre-op because of the part of the tough part working on what is
The
in
floor.
floor.
Uh-huh.
So I think that might answer
Yeah.
the part of the communication part and the
The first
documentation.
time when I arrived here in the US, documentation really was one of my, I would say, dilemma, because I mean during our time there was no computer.
Yeah.
It was the, remember the floppy disk before,
Yeah.
Mike? It was like that,
I
and
heard that.
then it was the basic computer, and then when I came here, like, oh my god, different hospitals has different
Different.
charting systems. But the only thing that is good with the documentation here is that if, for example, if your patient will go to another hospital or you will go to another hospital,
It follows them.
it follows, like, because my chart, or we call it the epic or EMR, whatever is their
Yeah.
documentation system, you can even see their old files from the different hospitals. That is just like what is good. But in the Philippines, I would say, or um, the paperwork and the paper documentation, it's still hard, because I mean you cannot put every time or forever the papers in the archives. It will be rotten by this pest,
Yeah, it's
whatever, how
not.
the paper pest, I don't know how you call them. So I
Yeah,
mean,
there's always an advantage and
uh-huh.
disadvantages of
Yeah,
each
that's
part.
Yeah.
Because which is true, because the errors for giving medication was lessened too, because now it's scanned.
Yeah, it is
Before, we have lots of medication
Yeah.
errors because we only rely on, we even have this we compute ourselves the dosages. Now the pharmacy is
Oh,
doing that
yeah.
part.
The
Which is
pharmacist is
good. By the way, for those nurses in the Philippines that wants to come in here, you don't need to do the calculations anymore, because it's already calculated and
Yeah.
it's already on the MAR. And that's the good thing too with the computers, that they it's for the patient, because they're more here in the US. I think everywhere we want our patient to be safe, and then that's why they have this stuff that they run, and make sure that we have a zero
Errors.
errors, and which is kind of nice, because when you scan the medication and it's not for the patient, it pop up, are you sure this is for the patient, are you
Yeah,
sure? And then
that's
if
true.
you scan the medication that, like, it's a 50 milligrams of metropolol and the patient's only requiring 25, it will pop up on the screen that patient's only taking
It will have a
25.
red alert.
Yeah.
Just to remind you, if you're scanning the insulin, make sure that you're giving the right insulin. It's not ml, it's units.
Yeah.
So which kind of, it does lessen the errors for medication errors, because of the technologies that we have here, and we don't do I hate calculations. So.
Yeah, and even with hanging of the antibiotics, I mean, I love this IV machines, because we have what we call the library of medications. You will just like press, and then it will have, like, if you're oh, I'm going to hang this Zofran or whatever, Zosyn, like, it will just like compute on the calculate, for as
It's
long
so
as you hang
calculate.
it right.
Yeah.
It's
That's
it's
right.
neat. It's neat.
Yeah. Talking about strength between internationally educated nurses and locally educated nurses. So, what strength do internationally educated nurses bring, and what strength do locally educated nurses bring?
I guess for the internationally, it's more of what Jen was saying. It's more of the skills, because um, the students here in the U.S., they are purely observations. I can remember when I was in the Philippines, wherein you cannot graduate if you are not going to have 10 cases of handles and 10 cases of assist
Assist.
in the delivery rooms. And same also with the operating rooms. You have to have 10 major cases and 10 minor cases. And those are actual cases wherein you're going to let the charge nurses of the hospital sign and question you before they will sign that you have really done uh, that procedure.
So the student here are not allowed to pull the babies out from
Yeah.
They're
children.
not. They were just
No.
observed.
Okay.
Oh, purely observation.
Okay.
OR, purely observations. They are not allowed
Yeah, they're not
to
allowed.
circulate. I can remember we have to know the hand techniques or the hand
Yeah.
signals of
Yeah.
the doctors. If the doctors will do like this, then that means to say I need a scalpel. If the doctors will do like this, I need scissors. So that is why we have to learn also in if we are on our OR course, the that subject, I can't remember what particular subject was that one. Oh my god, we have hand signals that we have to memorize before we can assist a doctor. So that is how tough I would say. It's the skills, but for the internationally I mean for the locally or the US grad educated, the only thing is because I would say probably because they are really obliged to read books, because remember, as what I'm telling you, their program is more on the accelerated program, so they have to know and read in advance. So that is why they're very good in theory, they're very good in
Comprehension.
comprehensions, but let them do the skills. No.
Yeah.
Yeah.
Because
Yeah.
true.
Yeah.
True.
Yeah.
Because they even at the age we are only like for reading part in the Philippines is not, it's just we study because of we have a test or
Test,
something.
yeah.
It's not developed since we're in locally
Yeah, that's true.
education is they already start when they're like kids to start reading
Uh-huh.
books, and they're really into books. And you're right, it's the I it just click in my brain, it's the comprehension that we Filipinos, most of the Filipinos lack.
Yeah.
But
But
the
when it comes to
skills-
skill, just that is why most of the Filipinos are visual learners, because we love the skills. Like, just teach me one time and I can do it.
Yeah.
Just teach me how to click these machines and I will do it.
Yeah.
But when it comes to like, oh shoot, like what I'm going to do next? What could be the sometimes they because they read books too much, and because of the, I would say, the advanced research that they're doing, it would develop sometimes their critical thinking,
Yeah.
which Filipinos sometimes because of the comprehension part.
And I
But the
think
skills.
that's why with the skills for us, because we started our
Uh-huh.
skills
Early.
early, compared to the one that's locally trained over here. And the good thing with the locally trained over here is the language, because it's their language.
Yes.
Yeah.
And then the culture, of course, that's the other thing, and the equipment that they have, because they already started
Yeah.
with it.
Yeah.
For us, it was just like, oh my God, what is this big
Improvise.
one? And like, we have all the equipment. They have this rounding. We've been rounded with our manager. What else that you need to make your job easier? And I said, why we don't have this in the Philippines? We need everything in the Philippines, but that's what we do. We do rounding almost every 2 or 3 months. We rounded by our manager and see how we do, what do we need,
Yeah.
and they will provide it. And I said, this is so nice. I mean, we are all provided what we need
Yeah.
so that our job will make it easier, of course, to deliver safe care to our patients. And that's the only thing that I always wish that the equipments that we have here, that we have also in the Philippines. But the thing, I mean, we probably with the private hospital, I think we already Philippines already have all those technologies. But the thing is, not all Filipinos can afford it.
Yeah. Not all hospitals in the
Not all.
Philippines.
Yep.
Only we call it the Campanilla hospital, the high end
Yeah.
hospitals.
Only.
Oh, by the way, I would like to add something when it comes to education side for the
Locally educated and
The-
internationally
yeah.
educated. Yeah.
you know what? Here, the instructors here, to tell you honestly, it's very easy to teach classroom. It is because all the lectures are standardized. You are given all the the how do you call this one? The PowerPoints. All your notes are there. all you have to do is how you're going to deliver your notes,
Oh, that
and
is neat.
yeah, how you're going to how do you call this one, how you're going to deliver your notes, how you're going to expound your powerpoints. It is because so that it would be easy for them also. Let's say, for example, I am very, very sick, and an instructor would cover for me. And that instructor cannot say no, because the thing here is that if you are a master's prepared, you should know everything.
Yeah.
That is their concept. So the thing is, if somebody would cover for me, she's like, oh, I'm not going to cover that one because, like, I'm a psych teacher. I'm not a maternal child teacher. But since you have the same standardized, all you have to do is, that is why sometimes the students find it so boring, because if the instructor that is covering is not really that is not really her specialty,
Yeah.
the tendency is that instructor will just read whatever is in the PowerPoints, because
Yeah.
she cannot expound, because,
Yeah.
like, although she has the a little, I would say,
Basic
little
one, yeah.
knowledge, basic knowledge, but when it comes to specialization, she
Yeah.
cannot.
Exactly. You're right.
So, but the thing is, I guess they're making also it standardized so that anybody can just cover.
Jump in. Yeah.
And then aside from that is that, so that section A and section B, let's say for example you have two sections in that cohort, um, there will be a comparison, like why is there so many failures in section A compared to section B, when in fact it's the same teacher with the same standardized materials, so whatever. So that is one difference also.
Yeah.
And then the other thing too, I think in international nurse, especially in the Philippines, we work in a rotational.
Correct.
We are not just in med surge. So when I was my practice when I was in I keep on saying Southern Islands. Now it's Vicente Soto.
Yeah.
But
But it was the old name.
yeah, no, Southern Islands. Anyway, we
But the old
rotate.
people from people still knows about
we
it.
we rotate. So from 6 months I'm in med surge, and then in another 6 months I'm gonna be in neuro.
Correct.
And in another 6 months or a year I'm gonna be in ortho. And in another 6 months it will be oncology. So we are rotated in different
Units or
units
wards.
in the hospital. But here you are specialized. You're only med surge, or you're only L&D, you're only pre-op. So when a pre-op nurse go to a med surge, she get lost
Yeah.
and stressed out.
Yeah.
I don't know
Yeah.
what to do.
Yeah,
What am I
that's
what
true.
am I doing here? So they get really frustrated when they get floated or help out. When they get floated, no one get floated or have patients. So if I'm a pre-op nurse going to a med surge, I can only task. I
That's
cannot,
true.
because I cannot do their job.
Yeah. You're right.
But in the Philippines, we are rotated in different unit. We
Yeah.
don't. They don't care. It's like, okay, Genevieve, you go to ortho. It's like, what? What am I doing ortho? over
Yeah.
there? But we already ready. Okay, I'm already on ortho the next week. I have to get ready for ortho.
In the Philippines, actually, they trained us to be generalist.
You're
I
right.
know
You're right.
exactly,
You're right.
exactly. And then the other thing too, because since you're a clinical education, I shared this to my coworkers because I told them that during my fourth year in nursing, because we have 4 year BSN in the Philippines, that we do case studies, and there was like, we don't do that over here.
Yeah.
We don't do case studies. They only do case studies if you do master's degree, but not for BSN. Because I was telling them, oh, I made 2 books, and said, what are you talking about? It's like, we do make case studies. It's required.
Yeah.
We even defend ourselves when we do
Yeah.
case studies. If we can defend ourselves and fail us, we have to do it all over again, and we cannot graduate. And I said, really? I said, here I think it's only for master's degree, not for the BSN. So I think that's the other thing to it. I felt like, okay, are more advanced than an educational system compared here? And that's why I was like, tell my friends, you know what, that is so wise that you send your son or your daughter for nursing in the Philippines. It's cheaper, and I think they can train. They'll be trained more compared of doing it here. Aside from being very expensive.
Yeah.
You think the program is better than here? I mean,
There
program
are
wise.
there are really like
I don't know the educate because I felt like this is what I heard. I don't know if it's the same nowadays in the Philippines educational system
Yeah.
that we have. Ours is very strict and
Also, yeah.
rigorous. I don't know if it's the same though, because I felt like they were just producing a lot of nurses nowadays
It's
just
more
to.
on mass production.
It's like mass production is not more. I felt like it's not more quality now.
Yeah, that's
It's
true.
more in quantity.
Yeah.
And to tell you honestly, Genevieve is very, very right because when I first went home to the Philippines, after being a clinical instructor there for so long, oh my God, I was so shocked. Because when I came back to the university where I graduated with my undergraduate, one of my, I would say, my very notorious student that is not even submitting requirements is now an instructor in that university. I was like, what? What the heck?
He- That,
Him-
prob-
I'm so
that,
sorry.
he probably changed.
Nakakagulat ba?
Yeah, nakakagulat. Like, oh my God, hindi nga ito nagsasubmit ng requirements ngayon. How can he or she be a role model to the students? Like, what is she doing? Hunky-funky? Like,
He probably
I hope she
changed when he get
changed.
when we get mature. Sometimes
Yeah.
the late
Yeah.
maturity,
I-
especially with
Honestly, I know a lot of people like that. They were just like
Just nothing,
rolling the
uh-huh.
papers, put in the pocket, and then go home. I don't know. If
I
they're
know they're
studying
more successful than.
but they're now
oh
here.
yeah,
They're-
that's
yeah.
true.
During my PT days, yeah.
Yeah.
Next question is for you. Being a clinical instructor, what common challenges do you see among nursing students, regardless of the background?
Oh my God. Number one is respect. Because even Jen was like saying this. Students will just call me like Chona, like, excuse me? Are we on the same level? And then that is why good that we have a dean right now in our college that is also, or rather, who is also very conservative. As much as possible, he doesn't want students to call instructors or professors in rather with their first names. So he's always disseminating and telling students like, no, you are not in the same level and they have earned their degree for that. So you have to call them, if you don't like to call them professor, instructor, you just call them by their last name, just like in the military. But never call them with their first name because you are not sisters, you're not on the same level. So it's more on the respect because I can also remember when I used to teach in the university, I mean in San Carlos, I can really it's not that probably I don't know during my time probably some of the students are branding me as one of the terrors instructors. Uh, once they will hear the tick of the tick-tock of my
Shoe.
shoes, they know that our instructor is coming. They will like start dispersing and going to the classrooms. And then if you're going to reprimand or say something to the student, internationally educated nurses, they will just like not say anything. But here, oh my God, they will answer you back. They're very aggressive. I would say like to be like subtle, like uh, assertive. Okay, they're very assertive. They will really fight. They will really fight with you. Fight for the rights. I'm sorry, fight for the rights and everything. So it's really challenging for me. Like students, like oh my God, in the Philippines, just
Yeah.
like I'm going to make my eyes big. They will
That's
be
the
scared. But here, no matter how you make your eyes big, they will not be scared.
No.
The more they will fight with you. Like
Yeah. That's the other thing too with the culture.
It's
Is
a
that
culture thing,
that's
yeah.
a culture
Yeah.
thing. It's way different compared to us. And that's why sometimes it's like, okay, most of my kids like, "Mom, you're not in the Philippines anymore." And it's like, "You're right, but I'm still a Filipina."
yeah,
Yeah.
that's true.
But yeah, it is challenging for you, even if in our unit, because
Yeah.
you're trying to teach them, and they get defensive, And I said, how can you
Yeah.
learn if you become
And
defensive?
then you will be branded as the bullier.
The bully nurse.
Yeah, the bully nurse. She's
It's like,
asking everything. Why she wants to know everything?
no,
Like,
for me, that's what I do too. Is I tried to like click their brain and do critical thinking, but sometimes they get defensive and
Uh-huh.
felt like you are judging them, that they don't know what they're doing.
no, actually, the thing, Jen, is that as when you ask them question, they're thinking that you are trying to test their intelligence, which is not. We're just like asking for the safety. Like,
Yeah.
did you do this? Did you
Yeah,
do
exactly.
that?
Uh-huh.
Like whatever. Like, I mean, it's
It's
really
it's again it's culture.
culture.
It's the
Yeah.
culture thing.
So the next question is, what are the some common misconceptions about internationally educated nurses?
Misconception is,
Plenty,
huh?
plenty.
There is a plenty one. One of this is it's more they felt like they get to be judged over here and treat as an outsider since they're not from here. And I think and that's what I've noticed too, that Filipinos in a unit that
They cluster.
they cluster. They don't kind of join to the group, and because they already have this mentality that okay, I'm not the same as them. I might probably, and they felt like they're outsiders, and if they see another Filipinos, they clump to each other and be with the Filipinos. And sometimes and most of the time, because I know one of the co-workers, I work in a unit and I was working night shift, and every time we eat for breaks, all the Filipinos gathered with all, and they share with our food, and they would just like look at us, and it's like and sometimes hey, do you want some?
Join, yeah.
It's not that we are greedy or something. We are shy or embarrassed to offer our food. They might
Yeah.
not like it.
Correct.
So but the Americans felt like we don't want to
To share.
share.
Yeah.
So I try to explain to them, it's like it's not what it is. It's just like most of the Filipinos are shy to share. You might not like it. But in my unit, because I'm the only Filipina in my unit, I always bring something. They get so excited. Genevieve, is that pancit?
Yeah. Adobo,
Genevieve, is that adobo?
lumpia.
And sometimes I bring something new, and what is that? It's like I want you to taste it. If you don't like it, I'm not going to be offended. So, because it's new to you guys, and most of the time that I offer it to them, they get surprised and they said it's so good. So I felt like it's just us that our mentality that we get embarrassed that okay, they might not like it, especially if we bring fish or inununan. You will smell the entire
Totally.
break room. But
So you microwave it too.
I know.
I guess it has really something to do with, I mean, we are born being judged. So that is why our brains also are like, we are judgmental. So that is why, that is one of our misconceptions we're in. Like, oh, she might judge me with this one. Or she might judge me with my accent. She might judge me with my pronunciation. So that is why we tend to go to, I will go only to the Filipinos. I will only like explain to the Filipinos or whatever.
Yeah.
So my thing is that one of the misconception really of an internationally educated nurse is that we feel, probably because we cannot speak most of the time the correct grammar or whatever, we think that uh, they might also think that we are dumb. So
Yeah.
I guess it's like that.
Especially when giving report. They get so confused with me because our his and her.
Yeah.
These always mix up. Yeah.
Every time I get report or I give report and it is a male patient. I keep on saying her and said, Genevieve, are we talking the same patient? I was like,
That's true.
oh, you know what? Yeah, because our his and her. I tried to explain it to them because our his and her we only call just one word. Ikaw, kita, siya. But in English, it would be her for a female, him for, and it's hard for us. And I think this is also the struggle for Filipinos to communicate with them because they get confused and said, "Are we talking the same patient?" Because you say her, and it's a male patient, and I said, "I am so sorry," because that's always our problem. I'm been here what more than 20 years. I still have
Me
that
too.
same.
Me too.
I still
Sometimes
have
I'm
that
also the same.
struggle. So it's again it's the communication as well with the with.
Yeah. So last questions for this discussions before we go to the lightning round. What advice would you give to both internationally and locally educated nurses entering the workplace?
For the locally, I always tell them not to be hesitant to ask.
Yeah.
Yeah, you're right.
I rather I'm gonna be scared as your preceptor if you're not saying
Anything and
anything
you're
Anything.
at
quiet.
all. I want you to ask, even if you felt like it's stupid. Nothing stupid in asking,
Patient safety, nothing
because
stupid about that.
it's for patient safety. And for the internationally, same thing is to ask. And then the other thing too is because we're shy. That is our culture too. We don't want to voice out.
Yeah.
Even if we're drowning,
Mm-hmm.
we're just like keep on going, and then we're complaining at the same time. We don't complain to the person that who gave us a very hard
Assignments.
assignments, and then we're complaining to our coworkers. So it's hard. That's most of the international, especially with the
Yeah,
Filipinos.
yeah.
They do not voice to what they felt. If you felt like, okay, I'm drowning, I need help, tell them, I'm drowning, I need help. But because of our culture, that it's so bad for us to complain, we don't complain, and we just
Complaining
complain.
in our culture is this being disrespectful.
Exactly, that's the other thing too. We complain to our kapwa Filipino because we are aside from being scared to be judged, as like what you said, is we don't want to be disrespectful because we we complain of everything. But I think over here in the states, they're very
Assertive.
assertive, and and they want you to say something, because or else they will think that you can do everything because you didn't say anything, and and you're stressing out already. And I think that's what the other thing too, that you get burnout because of not telling, of not saying anything what you're supposed to be telling them to express how you feel.
Yeah.
And it's very, and then you will say, oh, it's unfair, because most of the, as I said, the culture of the Americans, they voice out how they feel. It's for us, we get scared. It's like we might be trademarked as disrespectful and rude because we complain. And I
Yeah.
think that's that
Or
thing.
we are afraid so much of being retaliated. Like, oh my God, I might be fired because of this one,
Or
or
confronted.
confronted because of this one. I was like that also when I was very new in Ohio, or rather in Cleveland Clinic. Oh my God, before even I was exploited by a PCT. Like, hey Chona, can you get a water for this patient? Like, whoa, wait. I'm the nurse here. I'm not the PCT. So how can I do my I would say my nursing job if this PCT keeps on telling me like, hey, did you make rounds on this thing? Did you place water? Like, wait. Who's the nurse now? You or me? Or who's the PCT now? You or me? And then before also, like, I was not very assertive. One doctor is always like, oh, can you get me the chart? And then I would at first when I was very new, I would just like give the chart.
Hmm.
But I've learned every time he's like, Chona, can I have the chart? Get it yourself. Can't you see I'm busy? I've
They
learned how
they
to answer.
they run all over you if you don't. It's
Speak.
not being rude. It's just like telling them, okay, I'm still doing something else. I will get back to you if I have time. But if you can't wait, if you want to do it now, I'm sorry, I cannot help you with
Yeah,
that.
that's true.
So rather than you have to left what you the important things that you do, because just to appease or please the other person,
Yeah.
and it will only jeopardize what you've been doing, which is supposed to be important, and then the other things that you're
Yeah. And then the
doing.
worst part is you're already helping them, you're already doing, and then still you are not being appreciated. So because you cannot please everybody. So I guess another advice that I would say is that learn when and how to say no. If it's a no, it's really a no.
Mm-hmm.
How to be firm with your
Mm-hmm.
no, not so that you will not be exploited.
Mm-hmm.
I mean, be
Because
assertive but not aggressive.
yeah,
Yeah.
because it really, with our profession, it's really important. You have to also take care of ourselves because it's a stressful job, and if we drown ourselves with all those unnecessary
Yeah,
stressors,
that's true.
that would really drown us. And I think
You're going to have the burnout.
it would, the burnout. The burnout is always the thing too, and it's not healthy, I would say. And that's probably why most of the Filipinos are suffering with hypertension at the early age. Because
Hypertension and diabetes because like instead of complaining you will just like eat 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 like all your stress.
I know it's very important. You have to have time for
A
yourself,
balance.
a balance.
All right, let's go to lightning round. Any first question that comes in your mind, and you can just answer it. Classroom learning or hands-on experience?
Hands on.
I will say both.
Probably, but
All right.
Because you know what, the classroom experience is sort of like a guideline, and of course the hands-on, it would
yeah.
always make
Yeah, you're
you
right.
work. Some other nurses would always say, "Oh, why are we learning this? We can't even apply this in the hospital." No, it's not true.
Yeah.
Those are guidelines. The one that you're learning in classroom, it's also very important. You have to learn those because those are guidelines, and that could be applied to what you're, especially in assessing a patient. So it's very important too. I think I would always say both.
So, but like I would say, being an international educated nurse, being educated in the Philippines, so we have this kind of balance with the skills and the theory also.
Yeah,
But
yeah.
we're skillful, I would say.
Yeah.
I would say yeah.
You would agree, right?
Hmm.
I guess the very reason why I'm saying like hands on because I hear this a lot from my students. We're in like, oh my god, that instructor is not teaching us. We can read books and we just like go to clinicals for hands on. So that's probably that's the thing why I answered hands on.
Yeah, but that which is also I mean, the very when you rank it, I would say hands on.
Yeah.
All right. So, technical skills or communication skills?
Communication skills. Because if you don't have the correct communication skills, your patient will not be able to understand you. And then, how can you be an effective nurse if you are not being understood? So, I would say communication.
Yeah, communication as well too, because it's very important. You can communicate
Mm-hmm.
everything as an advocate for a patient.
Hmm.
So you have to be on that good
All right.
part.
Confidence or experience?
Confidence.
I would say confidence.
Confidence.
Even if you have an experience for 40 years and you don't have a confidence,
Confidence.
it
That's true.
doesn't apply at all. It
Confidence.
doesn't help.
This next question, start lighting question. Mentorship or self-study?
Mentorship.
Mentorship.
Because you will
Mentorship.
learn different strategies from your mentors.
Exactly.
That is why every time a student will tell me, like, "Oh, I don't want to go to that nurse, Professor Pasaron, because like that nurse is just like an 8-month-old nurse," and then I would say to them, "No, even though she's 8-month-old nurse, still you will get a strategy that this veteran nurse might not be using." So there are things that because even the veteran nurses is still learning from the
And
new nurses.
in clinical setting, if we have new nurses, I rather them rotated in different nurse because we have different
Correct.
techniques,
Correct.
and she or he will learn in each nurse's techniques.
Yeah.
And she or he can find also the technique that it will
Yeah.
help her to survive in the nursing
Yeah.
profession.
For the nurse to be more systematic. Oh, I will get this technique from
Mm-hmm.
Genevieve. Oh, I will get this technique from Mike, which is good if you're
Yeah.
going to have an incorporation of different techniques and
Yeah, you're
strategies.
right. Last question: teamwork or independence?
Huh,
Teamwork.
That is
Teamwork.
very
Very.
vital and very important. You have to be a good team player.
Yeah.
Yeah, that's true.
So even if you're assigned of a certain patient, because I always see this, observe this to some other nurses. Oh, that's not my patient.
Yeah, that's true.
And this patient's already drowned. I mean, this nurse, there's another nurse or your coworkers is drowning, and you're just sitting right there not doing anything. You have to offer help for that nurse. And I think it's vice versa as well too. If you start as a good team player, it will
Spread out.
spread out. Rather, if you start as a lazy nurse, the new nurse that will be following you will be the same. Oh, she didn't even do anything
Yeah.
at this point. She didn't even help. So and especially with those, it's very. I mean, it's. I said teamwork is very
Yeah, it's
important
really
because
very
you
important.
are taking care of another human being, and also to prevent burnout from
Burnout,
the
yeah.
nurses, because we in our unit, I'm always like proud of this of my unit. I mean, we I felt like we're already out. I always call them as a work family because we help each other. We look at each other's. Okay, I'm not doing anything right now. Let me just check on my coworker, and they're always like checking and asking. It's like, hey Genevieve, do you need help? Genevieve, are you okay? They're always like follow if I'm not if they're sitting right there and they're already done checking in a patient, they stand up and check in other nurses, which is a very very good.
Yeah.
And we always have a healthy relationship. And then most of that's why most when now that we're hiring there are a lot
hire
of
a lot.
nurses in other units wants to come to us because they see that we're
Uh-huh.
happy. All of us are happy because we have a good teamwork.
Okay, that's nice. That's nice. Well, thank you so much for both of you, Katambay Tona and Katambay Jan, and for giving us your inputs and, of course, your experience, being a long time, decades of experience. And takeaways: both international and locally educated nurses are valuable. They bring different perspective, and the goal is safe, compassionate, and a high quality patient care. Do you have anything to add for those upcoming internationally educated nurses?
I would like to say, because I really value communication, please, even though you are in your houses, speak English.
Now, the other thing too is that you're passionate with this
Uh-huh.
profession. If you don't have that passion, if you just come in here just because you're earning dollar and you don't have that passion as a
You
nurse,
will not last
you will
long.
not last and you will not survive. So I would say the passion of doing this profession.
Well, to all nurses and internationally educated and or locally educated nurses, thank you for your dedication and service. This is Tambayan ni Juan sa Austin, and see you next episode natin sa dito. Thank you and have a good
Thank
day.
you.
Have a
Thank
good
you for
night.
having us.
No bashing.
Thank you.
Okay.